Imagine this. It's 3 a.m. You're awake, but not for any good reason. A dull, persistent ache has settled deep in your jaw, a strange sensation you can't quite place. Your left arm feels heavy, numb, as if it's fallen asleep and refuses to wake up. A cold, clammy sweat begins to spread across your body, chilling you despite the stillness of the room. You try to rationalize it. It's just stress from that looming deadline at work. Or maybe it was that late-night takeout. You tell yourself it's anything but the one thing it actually is. Because in that quiet, deceptive moment, your heart is silently being starved of oxygen. A part of it is dying. This isn't a scene from a movie. This is the new reality of cardiac arrest in 2026. The dramatic, chest-clutching collapse we've been taught to recognize is fading from the picture. In its place is something far more insidious. Heart attacks have gone silent. And because they are silent, they are becoming more deadly. We're seeing a staggering 15% increase in fatalities among people who never experienced the classic dramatic warning signs. They aren't falling to the floor in agony. They are dying quietly in their office chairs, dismissing shortness of breath as fatigue. They are dying in their cars, mistaking chest pressure for indigestion. They are dying in their beds, while scrolling through their phones, completely unaware that the clock is ticking on their own survival. This window of time is what emergency physicians call the golden hour. But for a silent heart attack, it's more like a golden 30 minutes. In this critical period, every second dictates the outcome. Your decisions can mean recovery, or irreversible heart damage, even death. This isn't just about you, it could be someone beside you, a partner, parent, or friend. Recognize the quiet signs and know what to do. Today, we are going to cut through the noise and the confusion. You will learn the exact life-saving protocol that doctors and paramedics want you to know. We will show you the simple body position that can immediately reduce the strain on your heart. We will reveal the one over-the-counter pill that can buy you precious time and the critical, non-negotiable actions you must take when calling for help. Every detail we share is a tool for your survival kit. What you learn in the next few minutes could save a life. Hi, I'm Dr. Mamona, helping you feel better, live better, and stay well. Let's dive in. To understand how to survive a heart attack, you must first understand the killer. Your heart is a relentless pump, beating over 100,000 times a day. But even the most powerful engine needs fuel. That fuel is oxygen-rich blood, delivered by a delicate network of coronary arteries. For many of us, these vital pipelines are under silent assault. Modern lifestyles, chronic stress, diets high in processed foods, and a lack of physical activity create a perfect storm inside our bodies. They don't just strain the heart, they poison the very vessels that feed it, turning them into ticking time bombs. The process is slow, insidious, and it begins with a single spark: inflammation. This chronic, low-grade inflammation damages the smooth inner lining of your arteries, making them sticky. Bad LDL cholesterol circulating in your blood gets trapped in the artery wall. Your immune system responds, sending white blood cells called macrophages to clean up the mess. But they consume so much cholesterol, they transform into bloated foam cells. Over years, these foam cells accumulate, forming what's known as a fatty streak. This is the first visible stage of atherosclerosis, a silent lesion that can begin in your teenage years. As the plaque grows, your body tries to contain the damage by building a wall around it, a fibrous cap. This cap is meant to be a protective barrier, separating the unstable, lipid-rich core from your bloodstream. For decades, this process can continue without a single symptom. The artery narrows, but your heart compensates, and you feel nothing. The danger lies in the stability of that cap. Then, suddenly, the rupture occurs. A surge in blood pressure, intense stress, or ongoing inflammation can weaken the fibrous cap, causing it to tear open. The volatile, fatty contents of the plaque are exposed to the bloodstream for the first time. Your body mistakes this for a severe injury and initiates its emergency clotting response. Platelets rush to the scene, forming a plug that rapidly grows into a blood clot, or thrombus. This is the moment the ticking stops and the bomb detonates. The clot can completely block the artery within minutes, cutting off all blood flow to the section of heart muscle it supplies. Starved of oxygen and nutrients, the heart tissue begins to die. Once that muscle turns gray, it cannot be recovered. You lose approximately 10,000 cardiac cells every single second. This is not the time to wait and see if symptoms pass. Early recognition and immediate action are what save lives, and the signals aren't always the dramatic chest-clutching scene we see in movies. Even subtle symptoms can signal catastrophic damage: a dull ache in your jaw, profound fatigue, a sudden cold sweat, nausea, or a wave of unexplained anxiety. These can be the silent warnings of a heart under attack. Understanding these signs is your first and most critical line of defense. Your first instinct might be to lie down, but you must fight it. Do not lie flat. Lying flat increases venous return and can overload the heart and lungs. Instead, adopt the survival stance, the W position. Sit on the floor with your back straight against a wall. Bend your knees and place your feet flat, creating a W shape with your legs. This position uses gravity to reduce the workload on your heart and lungs, stabilizing your circulation and preventing sudden collapse. It may feel unnatural, but it buys invaluable minutes. Now focus on your breathing. Panic causes short, shallow breaths. Take control with a calming rhythm. Breathe in through your nose for 4. Exhale through pursed lips for 6. In for 4, out for 6. This helps regulate heart rate and improves oxygen exchange. Next, medication. If you are not allergic and have it available, take one standard 300 or 325 milligram aspirin. Do not swallow it whole. You must chew it. Chewing allows rapid absorption through the mouth lining, working in minutes to inhibit clot formation. Avoid ibuprofen or naproxen. They can interfere and increase risks now. With your position and medication handled, call emergency services immediately. Do not call family first. Every second is critical. State your age and gender and say, "I think I am having a heart attack." Provide your exact address and say the front door is unlocked. Use speakerphone to keep hands free. After the call, prepare for arrival. Unlock the front door and, if possible, prop it open. Return to the W position near the entrance. Keep your phone on speaker and stay calm with controlled breathing. Paramedics need clear, immediate access. Wearable technology can help, but during a heart attack, constant monitoring can worsen the situation. Observing spikes in heart rate or stress triggers adrenaline, narrowing arteries and intensifying the clot. Once emergency services are contacted, remove the watch. Focus on breathing, positioning, and staying calm. Research from 2026 shows repeated monitoring in acute cardiac events can worsen outcomes. Physiological stress directly impacts clot formation and heart strain. If you arrive at the hospital within 60 minutes, survival rates exceed 90%. AI-guided stents restore blood flow in minutes, limiting heart damage. The most effective heart attack is the one you never experience. Chronic stress, grief, and loneliness trigger inflammation, increasing risk. Prevention is both a lifestyle and medical strategy. Regular exercise, balanced nutrition, mindfulness, and stress reduction reduce inflammation and protect your heart over time. Here is your professional guide to heart attack survival. 1. Recognize subtle warning signs: jaw ache, left arm numbness, cold sweat, nausea, sudden anxiety. 2. Immediately sit in the W position to stabilize circulation. 3. Chew 1 300 mg aspirin to prevent clot progression. 4. Call emergency services immediately. Give age, gender, location, and keep the door unlocked. 5. Remove wearable devices and focus on calm, steady breathing. 6. In hospital, AI-guided stents can rapidly restore blood flow. 7. Prevent future events with exercise, balanced nutrition, stress management, and inflammation monitoring. Every second counts. Acting quickly is the difference between life and death.
Thank you for watching. For more clinical insights into your wellness, subscribe to the channel. My verified credentials are listed in the description. Stay healthy.